I'm going to talk about the physical examination that we perform for patients who have lumbar radiculopathy from a disc herniation. And like any examination, we start with observation. And this means just observing them walk, seeing if they have pain when they walk, seeing if they can walk on their heels, if they walk on their toes. And just this simple observation, having the people walk in a few different positions can give you a good idea of their pain and of weakness that they may have. And next, we do sensation, we check their strength, we check their reflexes, we palpate the spine. We check for hip or knee movement, and that's important for people who come in for back problems. And just a quick examination of their hips and knees, just checking their range of motion can give you a good idea of whether or not some of the symptoms may be related to their hip or their knee. And finally, we do some special tests. So step one is observation. Step two is then to check their sensation, and this is similar to what we talked about in the last session. Which is to check the sensation in the specific distributions of the nerve. So here's a diagram which kind of shows where you can check for different sensations. Typically, for L2, we check in the upper medial thigh. For L3, we check at a medial knee. For L4, we check on the medial ankle. L5 is usually the dorsum of the foot, and S1 is more so on the lateral aspect of the foot. In terms of strength testing, we check for hip flexion. We check the strength of the hip abductors or adductors. We check for quadriceps strength, tibialis anterior, which can be L4, L5. We check the strength of the EHL, the EDB, as well as the gluteus medius, which are all because of related to L5. And finally, the gastrosoleus, which is S1. Typically, we check for the patellar tendon reflex, which is L4, and the Achilles tendon reflex, which is S1. And then we do some special tests. A straight leg raise test is the most common one. Basically, what we do is we have the patient lie down supine. So if you imagine that this is the head of the patient and they're kind of laying down supine, this is their knee, this is their ankle. We'll have them raise their leg so that it goes up like this. And if in this position they're having a lot of pain in the leg, that's a positive straight leg raise test. Now, sometimes what we do is we have them dorsiflex their ankle. So we'll kind of move the ankle in this direction. And if they have pain, again, that's an added thing for radiculopathy. And then sometimes we also can push behind their knee to again stretch the nerve. And if that causes pain, that may be a positive test for radiculopathy as well. And essentially with all of these tests, what we're doing is stretching the nerve, stretching the sciatic nerve. And this is typically positive for patients who have symptoms from the L4 to S1 nerves. The crossover test, this is the second one here. Crossover means that for patients who have a large disc herniation, if you lift up their, let's say, right leg, they'll have pain in the left leg. And that's essentially indicating a large disc herniation. And then the last one is the femoral stretch test. This is the opposite of the straight leg raise test. In this case, you have the patient lie down prone, you extend their hip and flex their knee. And so what you're doing is you're essentially stretching the femoral nerve, which is made up of the L2, L3, and L4 distributions. And if that's positive, that may indicate to you that the patient's pain is coming from the upper lumbar segments as opposed to the lower.